Our next session is the healthcare panel. And this is a topic that has affected every one of us in 2020, whether we were in good health or not. In this panel, we've got Madhav Marathe, who is a passionate advocate and practitioner of transdisciplinary team science. During his 25-year career, he has led a number of large transdisciplinary projects and groups. His areas of expertise are network science, artificial intelligence, high performance computing, computational epidemiology, and data analytics. Madhav has published more than 350 articles in peer-reviewed journals, conferences, and workshops. He is co-leading a large team of researchers at UVA and its partner institutions as they develop innovative AI and HPC-oriented decision support systems for COVID-19 planning and response. Madhav has a bachelor's in computer science from IIT Madras and a PhD from sunny Albany. Our next speaker is Rekha Ranganathan. Rekha is SVP and GM Imaging Solutions and Platforms at GE Healthcare and a proven global business leader with over 20 years of experience. During her stint at Philips Oncology Division in India, she was recognized as top 35 women leaders in technology to watch by Economic Times in 2017. Rekha has a bachelor's in metallurgy from IIT Madras, a master's in mechanical engineering and material science from UC Berkeley, and an MBA from Wharton. She is happily married, has 2 daughters, and lives in Boston. Our next speaker is Vaidehi Narayan, who is a professor and chairperson of Computational and Quantitative Medicine at City of Hope Cancer Center in the Los Angeles area. She graduated from IIT Madras with an MSc in chemistry and PhD in quantum chemistry in 1986. She did her postdoctoral studies with Nobel laureate Dr. Warshall at the University of Southern California and also worked with Dr. Goddard at Caltech. Vaidehi has committed herself to developing theoretical and computational methods to make predictions prior to experimentation in the challenging field of protein structure and dynamics and designing safe drugs with minimal side effects. She received the Distinguished Alumni Award from IIT Madras in 2016. Vidya Gopalakrishnan is Chief Development Officer at Retrotope, Inc., with over 24 years of drug development experience in various therapeutic areas. Vidya received her PhD in bioorganic chemistry from the National Chemical Laboratory associated with the Pune University, and she got an MSc in chemistry from IIT Madras. She has held postdoctoral positions at Penn State and Stanford University School of Medicine. Outside her profession, Vidya is a board member of Pratham USA, the San Francisco chapter, and Ekashri School of Yoga. She is also a certified yoga instructor and a passionate practitioner. Moderating this fantastic panel is Karthik Kuppusamy, who is Vice President and General Manager of the North Region of Quest Diagnostics in Boston. He is Chairman of the Board of Directors for both Quest Joint Venture and University of Pittsburgh Medical Center, and Chairman of the Quest Joint Venture and UMass Memorial Medical Center, and a board member of the Associated Clinical Laboratories Joint Venture. He was named in Boston Power 50 in 2020 for extraordinary work done by the Quest team during the COVID pandemic. Karthik and his team accelerated innovation and operationalized COVID test execution and have delivered more than 4 million COVID tests, saving lives and giving hope for families in need. Karthik earned a PhD in electrical and biomedical engineering from Washington University in St. Louis, an MBA in finance and operations from Marquette University, and he holds a master's in electrical and biomedical engineering from IIT Madras. Detailed bios of all speakers are available under the Speakers tab on your website. Please submit your questions in the Q&A tab, and they will be answered after the event by the panelists. Over to Karthik now.
Thank you, Narayan, for your warm and kind introduction. And good morning, good afternoon, good evening, everyone. Welcome to the healthcare panel. I'd like to also do a special welcome to all the panelists here on the call, and welcome to the audience worldwide who are joining this panel discussion. I want to start with some facts, and these facts related to healthcare are important for the kind of discussion we're going to have with our healthcare experts. Today, we are 10 months into the COVID pandemic. More than 10% of the world population have been tested for COVID-19. We have more than 66 million positive cases today in the world. 1.5 million deaths have occurred due to COVID-19. More than 400 million jobs have been lost in the world. And several trillion dollars in lost economic output has happened. So with that context in mind, I would like to focus this discussion around and a call to action around three areas, on the people side, on the process innovation side, as well as the business side. On the people side, first and foremost, the people working in healthcare industry are truly superheroes. Their personal sacrifices every day, we all have to be very much thankful for, and I'm thankful for them. But the action is humanity needs the best minds to be working in the healthcare industry and the associated field. And we need always people to be, employees to be people and actually patient focused, of people working in the healthcare industry. On the process innovation side, healthcare industry has been ripe to many innovations. And honestly, with the bright minds we have, accelerating the technological innovations, driving cost disruptions, and applying telemedicine for all will truly transform healthcare and will be transformative for the world we live in post-pandemic. On the business side, I think many of you know, healthcare industry is critical to the economy of any country, and it's the fundamental, essential building block for any country, or even for any industry for that matter. So there are rapid advances that are actually required in personalized healthcare, precision medicine, and it's fundamentally needed for the survival of the human race and for the survival of every other industry that we are aware of. So with that three areas in mind, I would like to transition and actually start with a few questions. And first question, I would like to invite Madhav to give his perspective on this. And we are surviving the COVID-19 pandemic, Madhav. Can we prevent or reduce the effect of a potential next pandemic? If so, how? And really the broad question I have for you is, how do we prepare and respond for large-scale disasters that happen? And is there something up on the horizon beyond COVID-19 that we should need to be worried about? Madhav?
Thank you very much. Let me just begin by saying thank you to all the organizers, Karthik and Narayan and others, for a wonderful SANGAM session. And it's a pleasure and honor to be participating in this panel. So let me provide my perspective. As you have very nicely outlined, this is a 1 in 100 years event that we are all facing. And I do not think that in the near future, it is going to be easy, I would say virtually impossible, to prevent another pandemic. What we can potentially do is to reduce its impact. And in the interest of time, I've tried to highlight 5 different ways that we can do this. One is to develop effective pharmaceutical interventions. I'm sure Vaidehi and others will talk about it a lot, but better vaccines, faster development of vaccines, but therapeutics itself would certainly help reduce its impact. A second part is to understand the various ecological, anthropomorphic, and climatic drivers for outbreaks. We had written a paper on Ebola and why it happened then and what the impacts were. I think it's important to understand how diseases jump to humans from animals, which are usually the case when pandemic happens. How climate change will have increased impact on us. For instance, even small increase in temperature and sea level might impact us in a big way. And finally, increased urbanization and cultural habits might increase the risk. The third point is the impact of social, economic, political, and information systems. We've all seen the effect of infodemics, fake news, our societal adaptation, and political, back and forth. That, in my opinion, has a big impact on epidemics. There's an area that we are starting to build called socio-political epidemiology that goes beyond epidemics itself. The fourth point is improved mathematical and computational models that are tied together with real-time data collection. Models are very important in these times to assess the spread of the disease, to tell us which interventions might work, how to vaccinate, how to test, how to social distance. But these models are only as good as the data that drives them. And I think we have come to a point where you can actually do this in a very good way. And the last point here is that in the end, all these models and strategies are only as good as the implementation that we have. I would say that if at all we have failed in some form, it is the implementation of these strategies that we have developed. And in this sense, I think individuals, organizations, states, and countries have to work together. There's an apt saying in Sanskrit, which is Vasudhaiva Kutumbaka. We have to treat this as a family and view this that we are in a collective, and not view this from a selfish standpoint. To your question about a bigger disaster, I think COVID-19 pandemic perhaps is a warning to all of us that if we do not work together, we are likely to face existential crisis due to climate change. Its impact will be far worse. And once this change starts, unlike COVID, we'll have very little we can do to control what happens next. We are very close to a point of no return, and India is precariously placed in this situation. So I feel that we have important chance and opportunities, and hopefully we take good lessons from this and try and work together to try and prevent the bad side effects of climate change. Thanks.
Thank you, Madhav. That was very insightful. And you talked something about India, and it's something very near and dear to my heart. So, type 2 diabetes in India. I think we all know India is the diabetes capital of the world. 20% of the world's diabetic population and pre-diabetic population actually is in India. So with that in mind, I want to pose this question to Vaidehi based on your experiences. Are there other things, the silent pandemic, diabetes is a silent pandemic. And are there other serious diseases such as cancer and heart failure that could present a much huge challenge as, not just COVID-19, but a bigger challenge here? And what should we be, how are we going to deal with it? How are we going to avoid it? What are your thoughts and insights on that, Vaidehi?
Thanks, Karthik, and thank you, the organizers, again, for this wonderful opportunity to listen and learn. So, as you know, diabetes is an imminent pandemic, right? So, and that comes from inside. Viral pandemics come from outside, where the viral pathogens are in the environment, whereas the pandemic of diabetes is from the inside of the body. And you all know that, diabetes is caused by high blood sugar levels, and that stays high over a sustained period of time. So if you leave it unattended, diabetes by itself can cause collateral damage, like what Karthik said, in the heart. There could be kidney failures, as well as other even neurodegenerative diseases, which are, the diseases of the next century, or the next decades, I would say, is also possible because of diabetes. So the collateral damage that diabetes itself as a fundamental condition can cost the healthcare industry about $1 trillion. Okay, so, and as I would enumerate soon, it also has an impact on the environment. So how do we deal and prevent these costs, as well as, promote the well-being of human beings? So there are about 500 million people who are diagnosed with diabetes today all over the world. And about 98% of them have the type 2 diabetes, right? And about 350 million are pre-diabetic, and many of them don't even know that they are diabetic, right? That 1 in 3 Americans are actually pre-diabetic. So what we want to do is to take care of these pre-diabetic patients, not to go into the diabetic range at all, but reverse back to normalcy, right? So I'm not going to talk about the cures, because there are about 6 drugs in the market, and there are many more in the offing, and a lot of money is being pumped on research, understanding the fundamental causative reasons for diabetes. But I'm going to talk about what we can do at a grassroots level to prevent this epidemic, and what have we learned from COVID that we can apply to diabetes. I'll just enumerate a few factors. One is prevention of diabetes is very key. Okay, so there are a lot of lessons that we have learned from the pandemic. For example, we should adapt plant-based food, eat much on a daily basis, less energy-rich foods. I'm not going to prescribe a diet here, but I'm just saying all of us trying to switch to plant-based food will first improve our health very greatly. And also it is something that will reduce the carbon footprint and help the environment. So the other thing is, we all, instantly we were pushed to learn cooking in this pandemic. Quote, everybody cooks because many of the restaurants were closed, right? So I think in order, and we have to encourage and appreciate cooking skills across genders, and everyone should learn how to cook healthy food. And then we should start from the grassroots by habituating our children and grandchildren to eat healthy food. And as a reward to eating healthy food, we shouldn't say, oh, if you finish your broccoli, I'm going to give you a cookie. If you finish your broccoli, I'll give you some apple slices, right? So something like healthy food should be looked upon as something that you should yearn for and look for. And then it can be quite tasty too, if you cook it right. So, and then make exercise as part of our daily life chores, and, go to the walk to the grocery store and walk back with your groceries, and be sure to incorporate such physical activities in your well-being every day. So as consumers, if we change our habits, right? And we may be all doing it as a community already, but go and influence others in your community to do these. And if we do these, the food industry will change, because what you go and buy dictates how they change their regulations. So food industry today is very complex. It consists of the agriculture business. They also have these manufacturers, the retailers, and the food services, right? There are 4 different sectors in food industry. And together with government and nonprofit, they will come together if we as consumers from a grassroots way change our habits and then seek healthy plant-based food that's going to help the environment and reduce the healthcare costs. So I'm going to just stop at that. These are the things that we learned from the post-COVID pandemic that we can apply to diabetes.
Got it. Thank you, Vaidehi. I'm going to commit to having broccoli and apple slices after this panel discussion. Okay.
Sure, it's good. Way to go.
But thank you for your insights. Actually, digressing a little bit from a pandemic to something that's relevant for the audience around, Indian engineers, Indian healthcare environment. So I want to, Rekha, you have experience both working in India as well as work, have a ton of experience working in U.S. healthcare system. So, question to you: what role can India and Indian engineers take to advance healthcare and medical technologies, specifically, making use of things like artificial intelligence, machine intelligence, big data, data analytics? What are your thoughts and insights on this?
Yeah, so thanks Karthik, and thanks everybody and the organizers for having me. I think it's a very timely topic when we think about AI and data analytics, and obviously this has been a buzzword in the technology industry for quite a while. But in healthcare, it's only been gathering steam in the last, let's say, in the last 3 years or so. And to be very honest, COVID has only accelerated the investment there, because the intent here is to make sure that we are leveraging technology, whether it is remote or AI or data analytics, as much as possible. And then to address your specific question around what is the role India and Indian healthcare and Indian engineers can play here, it's a huge opportunity, right? I mean, I think India has always been a hotbed of innovation and entrepreneurship. I see majorly two great advantages specifically in the area of data analytics. One is the number of patients and the throughput that doctors in India see is much higher, at least 3 times higher than in developed countries. So that really means that the access to data is much more. So that's one big piece. The other big piece is that the regulatory system is not as cumbersome for example, as it is in the United States, with HIPAA, etc. Of course, it can be misused as well. But the idea is that the regulatory process allows you to experiment with data a lot more, right? So you have quicker pathways to approval and huge amounts of data. And given the disease burden, as just the other panelists were talking about on diabetes or cardiovascular disease, another big one is, TB and malaria, etc. And the access to venture capital funding, India is currently a huge hotbed of AI and data analytics. I mean, if you look at companies like GE as well as others in this space, several partnerships have emerged, and specifically 2 companies I want to talk about. I mean, I have no interest in them, but is Cure AI, and the other one is Doxper, and both are looking at how do we make radiology scans, for example, much faster in the assessment of, let's say, chest issues or lung nodule. They just released one for tuberculosis in India specifically, right? So once you have AI-based technologies that are allowing, quicker treatment or quicker diagnosis of a particular issue, it becomes that much easier for patients to be, taken care of. And then more importantly, these players are also applying for the FDA here. In the US, and with the COVID pandemic, the FDA has introduced a process that is much faster, specifically for AI-based applications, which was not there before. So that's also another big trend that is happening. So to summarize, 3 big things, right? Access to data, a lot of access to data, which can be harvested. The second piece is the regulatory process being easier there to experiment a lot more in the right way, hopefully. And then the third piece is the FDA being a lot more open. Now is the time for India to really do more.
Great. Thank you, Rekha, for your insights as well. Balancing between the needs in India market as well as what could be applied in the Western world as well. Similar question, Madhav, based on your experiences in the AI world, data science and epidemiology world. I think, how do we make healthcare more affordable, accessible, not only in India, but also globally? Can you share a little bit of your insights based on your experiences in that particular area as well?
Sure. I think, Rekha, and you have done a really good job setting the stage for me. Let me first reiterate a few points here. Digital telemedicine that you and Rekha mentioned, I think is a game changer for India. Doctors can see patients anywhere, and more importantly, patients in villages don't have to travel miles and miles to reach the doctors to get healthcare services. And I think it's not just AI, but a broad advance in computing and data technology, from 5G wireless to be able to build systems at scale, to have digital devices and sensing equipment. All of it, I think, adds to this overall possibility. Biology, of course, and advances that Vaidehi mentioned is a big game changer, in my opinion. Some of those technologies and ideas might be a little expensive to begin with, but the scale in India offers them a chance to come down in price very, very rapidly. We have already seen CRISPR playing a big role as an example in this. A third part that I want to sort of extend what Rekha really nicely articulated is data. And my view is actually we have a really interesting way to make healthcare affordable, because I think up until now, data value has not been rightly articulated to the folks who produce the data. It's largely the companies that deliver this data, such as large media companies, which have been asymmetrically compensated. But you, as a person, as a patient, is the owner of that data. And I think one way to think about it is to think about data as property and be able to monetize the fact that you own the data, because all the models that they make, all the technology in terms of radiation therapy and examining x-rays and CAT scans depend on the data. If it's your x-ray, in some way they should at least get some value from that whole training system, right? So I think there's a way to monetize this. And we have already seen entrepreneurs talking about it in Sangam and Rohini and others. I think this is a great way to do it. And last but not the least, to highlight what Vaidehi said, I think the best way to make this affordable is to do preventive medicine. Preventive medicine allows us to do this much, much better way. And this involves lifestyle changes in the environment, changes in food, social interactions, which we understand play a big, big role these days. Are actually a really important part of it. We have developed this idea of P-cubed analytics, which I think is a useful way to think about this. And it stands for pervasive, which means it's available everywhere, anytime, on any device. Personalized, which I'm sure we'll talk more about, and precise. And I think together, this provides a very nice and clear way for us to help folks in places like India. So I'll stop there, Karthik.
Right. Thanks, Madhav, and thanks for highlighting the importance of big data, both Rekha and Madhav, on this topic. Data can help make a lot of important decisions, and especially with vaccines now around the horizon. I would like to turn this question to Vidya based on your experiences on vaccine. The clinical trials is an essential portion of vaccine development. I think there's been tremendous improvements done. A vaccine that could take 3 to 5 years to get approval now is getting approval in less than a year. And data could also help us in terms of deciding which patients should get the vaccine, based on the effectiveness of each of these vaccines there. So what are your thoughts on this acceleration that's happened in clinical trials? How can it help not only in COVID, but also for other diseases that are silent pandemic, like diabetic, like Alzheimer's disease and things like that? Vidya, what are your thoughts?
Sure. Again, I want to echo the other panelists' sentiments. Thank you for the opportunity to be here on this, in this important panel. Before I get to the actual vaccine part, I can kind of juxtapose it with, typical clinical trials issues versus what happened in the vaccine era. So I'm in the pharmaceutical industry, and I have experienced firsthand, the impact of this pandemic on our ongoing trials. For any drug to be developed and approved, we have to conduct clinical trials. So with the pandemic, what happened was recruitment of patients pretty much stopped because sites had to be shut down. And if you had patients that were recruited, follow-up became an issue. So there was a report that said, ongoing cancer trial recruitment dropped by about 83% between April of last year and April of this year. So, this kind of disruption had a big impact, right, for in terms of patient safety, drugs for unmet needs, and so on. So that is the landscape. So now, on the other hand, so we all like, you mentioned, Karthik, the number and speed with which all these COVID-related clinical trials have been registered and initiated over the last just several months has been exceptional. Even under these, under normal circumstances, this is too much. Now, under a pandemic situation, it was exceptional. And new vaccines, with new technology have been developed and approved in less than a year, right? I mean, so one has already been approved in the UK, and two are pending. So what was different, with these kind of pandemic trials? Why do other trials take so long to complete, and what, worked for these pandemic trials, for these vaccines? So one is the urgency of the pandemic, right? And so we needed to prevent the spread. So some of, the changes here were, the technology, as many of us alluded to, the rapid advancement of technology utilization, and of course, virtual communication. Then trial managers, they started utilizing a range of platforms to hold important, discussions, such as with, trial management groups, with committees, you have data monitoring committees and other oversight committees, with sites, with sponsors, with funders, and even with participants. So that was the other thing. And then some of these critical trial processes, such as getting informed consent and data collection, they were all moved online. And any unnecessary administrative barriers for trial approval and setup, they were broken. And last but not the least, the collaboration, even amongst competitors, that was extraordinary. And there was a huge acceleration in the publication turnaround time. So these were all the changes. So what we need to do is see how we can capitalize on this collective experience, gain from all this, lessons learned, to accelerate, clinical research in areas like cancer, neurodegenerative diseases, etc., that we just spoke about.
Great. Thanks, Vidya. Thanks for that. I think we need it because I think there are several other unconquered diseases for which we need to accelerate treatments. Hey, I know we talked about this, and I think between Rekha and Madhav, you talked about, P-cube analytics, right? Pervasive, personalized precision. So I want to drill down a little bit more on that particular topic. Maybe I'll start, Vaidehi, maybe I'll go to you here based on your experience. So what is personalized medicine? What are its benefits? How do we think we should implement it? And try to tell us, in a very swift fashion.
Yeah, thanks, Karthik. So personalized medicine is going to be the way of life in future, the way of medicine is practiced in future. So just to explain it in a simple way, 10 years back, if two patients walked into a doctor's clinic, an oncologist, for example, let's take cancer, for example, it's close to my heart. And so if let's say these two patients were diagnosed with breast cancer. They were treated with very similar agents, chemotherapeutic agents. And so these therapeutic agents killed the cancer cells and all fast dividing cells in the body. So these chemotherapeutic agents caused collateral damage across other fast dividing cells in the body, and therefore caused side effects, serious side effects. So the cancer itself was a hard thing to face, and the cancer treatment was even more dreadful, right? So today in the post-genomic area, that is, we can sequence genome and try to understand the function of each of the genes in the genome, right? So today what has happened is, if the same two patients walks into the oncologist's office, they get there's cancer, they remove the tumor tissue using biopsy, and they sequence the information, the cancer genome, and I identify using statistical methods what type of genes are cancer associated in this tumor tissue, right? And then you can administer or treat that patient with that cancer associated gene specific therapeutic agent or a drug that will specifically target it. And this is called targeted therapy instead of something that has collateral damage across all fast dividing cells. This specifically kills only the cancer cells that have these cancer associated gene, So if two patients walk in with breast cancer, they're not going to be treated the same way. Depending on the cancer-associated gene in each one of these patients, they will be given different agents. And therefore, the collateral damage is less. So their lifestyle is good, improves, because they can go on with the side effects are far fewer and manageable. And then their life expectancy also goes up if you do a targeted therapy. So you're less immunocompromised, and so it's a lot better, right? So this is the example of personalized medicine. Where are we today, and where are we going with this, right? So there's a lot to be done. So we know that we can target certain genes that are disease associated. This is going to be applicable to diabetes and neurodegenerative diseases and so on. So the first thing is identification of genes that are disease associated. That is still in the research area. And data analysis methods and AI methods, machine learning methods are very useful. And what in medicine, we are taking a different approach other than compared to what businesses use AI for. We want interpretable AI. That is, we want to use machine learning methods that we can understand why certain features recapitulate the disease, rather than using a black box of AI methods and getting the outcome. So all these genome analysis has created a lot of data. And so anytime a patient walks in, you do the sequencing and you have this information to the doctor, right? So where we are going is, can we take the tumor tissue and understand how many different types of tumor cells are there? Tumor tissue is a very heterogeneous entity. It's not homogeneous. It's not made up of one type of cell. It's made up of multiple type of cells. So when a patient walks in, you take the tissue and you use computational methods to identify how many subtypes of tumor cells are there. And we have to design an agent that would target each one of these subtypes of cells, right? So we have a lot of work to do, where methods from physics and engineering and computations can help a lot for future personalized medicine. And this is going to be the way of life for treating all diseases. Yeah.
Great. Thanks, Vaidehi. I know you talked about the treatment side of personalized medicine. There is, I worked on the diagnostic side. So I want to ask a question to Rekha on this, because I know she has worked on it. Tell us more about the personalized medicine aspect of the diagnostic side, Rekha, of precision medicine.
Right. No, so I think Vaidehi touched upon a lot of the topics, right? I mean, the notion is really to make it tailored to the patient. So I think the way the industry is going from a medical equipment, whether it is a CT scanner or an MRI scanner, is making life easier for the radiologist to pick sequences or what are called, protocols, depending on the patient type, right? So if you're a South Asian patient versus a child versus somebody with a different, a BMI, and knowing how much X-ray dose, for example, when you're getting a chest X-ray or you are getting a, CAT scan, is being very tailored to the patient's anatomy and the patient's, history, for example, right? Again, like Vaidehi said, the industry is not there yet, but much faster and much ahead than we were like a decade ago. The other area that, diagnosis is helping as well is in this notion of cancer treatment, but really looking at how the patient's history has evolved over time, not so much in the medicine that has been given, but making sure that doctors and radiologists and oncologists can look at one single source of data, which is called a tumor or an oncology dashboard, and make sure that they are giving the right treatment to the patient. So those are the two main things, if I look at it very broadly speaking, that the industry is working on. And again, they are trying to do this as fast as possible, because now with COVID, getting many people to interact around a singular source within a Zoom or a physical environment has become that much more easier with the compute and all the 5G that we have.
Yeah, great. Thank you for that. I would like to transition to one other question here. Look, we have all been on a Zoom call here, and I've been, every day at work, whether we do this panel discussion, there is a mental health, challenge or mental health epidemic that's also happening. People are trying to balance work and life with this new normal. So Vidya, question to you, tell us how we can prevent actually having a mental health pandemic from happening. Just give us your thoughts.
Sure. Yeah, so I'm going to use, there was a recently published position paper in this, high impact medical journal called The Lancet. And it was very recent, and I'm using that as my source. So, Karthik, as you alluded, so the pandemic, we all know has taken a huge mental and psychological toll, not just in the general audience, but also people, frontline workers, and people who already had pre-existing mental disorders. So what happened is that these mental health systems had to rapidly adapt and change during the pandemic. So first, what they did was they had to implement acute responses for infection control. So that's the first thing, to stay away from getting infected, and then of course to continue the ongoing care that was already in existence. Then the other strategies, they implemented COVID-19 related, physical and mental health monitoring systems, and the data collected from such systems are being used actually to inform practice and to optimize care. So that is one. And then the other thing is they're trying to build upon the existing care practices and services and promote new practices to make it more expansive and also cost effective. So that is the second thing. And then, as Vaidehi just mentioned, this whole individualization and personalization of mental health services and remote delivery. The remote delivery may work in some cases and may not, but again, that's part of the experimentation process given the circumstances. And and then of course they're trying to expand the health insurance coverage for mental health. Of course, that is, I'm talking about here in the US. And last but not the least, so we spoke about nutritional management, but people have been tapping into a lot of spiritual practices, such as yoga, meditation, mindfulness, etc., to maintain some level of sanity under these unique times. So the bottom line is, the same interconnectedness of the world, right, that made the spread of this infection so rampant, that the same thing, provides the infrastructure that can be used to rectify, any system failures with the mental health practices, and, create better and best practices that can be shared, across the board. So those are some of the thoughts for the mental health system.
Right. Vidya, and also I know you practice yoga as well, and you're getting a master's program. I think that's part of actually improving the mental health and well-being, not only for yourself, but you're also trying to give it to others. So thank you for that. I would like to go to a topic, and I want it to be beneficial for the IIT alumni and future IIT students and existing IIT students as well. So question to Madhav, and I'm going to have the same question to Rekha as well. So I'll ask the question once. What sort of educational models are required now in this new normal? And what should IITs do and other schools need to evolve and train the next generation with this new normal? So Madhav, I'll start with you on this topic.
Sure. I think it's a really good question, and not an expert, but certainly I can provide my viewpoint on it. Let me start by first saying, all of us have said this, that COVID has been a big discontinuity in a certain sense. It has allowed new challenges, but new opportunities, and how education is imparted, how you learn, how you interact, and such. I thought about a couple of different ways that we could train next generation scientists and things we would train them in. The first and foremost, and this is something that our group has practiced, and I feel with some amount of success, is doing what we call team science, but really working in a team. I often feel that institutions do not teach how to work in a team. And I think it's actually extremely important going forward, whether you work in academics or you work in industry, to be able to work in a team. And that requires compromise, that requires diversity of views, that requires you to listen to somebody else. I think very, very important aspect, doesn't come through oftentimes. Second is notion of multidisciplinary training. The phrase people had used is you move from an I like training where you're deep in an area to a T like training where you have depth in one area but a lot of breadth. But I think people are going into a frame, they call it a pie, where you have depth in two areas so that there's a certain amount of overlap between two different areas. And then you have a certain amount of general strength across the board. The next point is hands-on training. We all know that we probably liked or hated our lab work in IIT when we were doing it, Smithy and such. Of course, maybe in today's world it would be slightly different, but hands-on work is important. I mean, purely theory-oriented work is not how I think one should teach. Another point that comes to my mind is one where you move away from rote learning, which is emphasized a lot in Indian context. And to some extent, even at IIT, I would say, to questions that get the creativity out and incentivize it in a meaningful way. It would involve metrics and ways to measure it. Classical exams are set up where you can do your, I'll use our IIT language, you do your tute sheets, you go to class, you answer the questions, you're done. I think that maybe is not the right model in certain sense. You have to understand how creativity is measured. The fifth point is I've tried to distinguish between curiosity-driven research, which is very important, and application-driven research. I don't think so one is better than the other, but I think both are important. And there's a big debate in scientific community on how you do this. And the last but not the least, and I think this is very important, is we have to change our perspective on learning from one where we go to school, finish our degree, and go to work. I think lifelong learning is here. In fact, I would argue that none of us are doing exactly what we studied in the 4 years. And in fact, every few years, we end up changing what we do. So you got to be ready to learn all the time. And I think this concept of learning followed by a break, followed by working for 30 years is not going to work out in today's world at all. So I hope that IITs try and get the kids ready from a mental frame of mind that this is not the only degree they're going to have. In fact, maybe there's no degree afterward, but certainly they're going to keep learning all the time from their friends, their fellows, and from their kids even. I think that's one of the important things. So I'll stop there and give Rekha a chance to elaborate on any of these points.
No, I think Madhav, you covered a lot of the ones that I had sort of written down as I was thinking about this question. I would only emphasize two things, right? I mean, you talked a lot about, lifelong learning. I also think, learning has become personalized, right? Just like we talk about healthcare being personalized. So giving different mediums and different options, and not even this whole notion of a semester being a semester is important. And then, giving the students the ability, whether it is, experienced students like ourselves or, the younger ones, how do they put it together based on where they see their own gaps in learning is sort of where I see the education system going. And this notion of teacher student is gone, right? I mean, everybody can be a teacher, everybody can be a student. So I really question what is the university system of the future, but maybe a topic of a different discussion. So that's the first point I wanted to make. The second point is, I transitioned from being an engineer to a consultant to a management person, and that's really what I do, but I've not, let go of my roots in engineering. But really where education in India lacks, I feel, is the emphasis on communication and behavior. You talked about it as you have to be able to work in a team. I work with many Indian engineers even today, I mean, especially in sites like Bangalore and in other locations, and Indian engineers here. The biggest barrier to growth from a career perspective, I find, is communication. And it's a topic very near and dear to my heart. So I wish, education would emphasize a lot of that, and then how do you then navigate an organization as well? So that's really what I wanted to add, Karthik. I know we are running short on time, but I'll turn it over to you.
Great. Thank you, Rekha. Thanks actually to all the panelists here, Vidya, Vaidehi, Madhav, and Rekha. I also want to thank the IIT Madras organizers as well as Narayan for giving us the opportunity to share the insights. I hope the audience, got a sense of some of the call to action, I would say, from our panelists, and truly some innovative ideas and thinking that they shared based on their experiences that could be applied. So I'm going to turn it over to Narayan. I truly want to thank all the panelists for your time on a Sunday morning. And Narayan, back to you.
Thank you.
Thank you, Karthik. This is a topic that, has affected literally or impacted literally everybody listening. And, we could have done a much longer panel, but in the interest of time, we have limited it to this amount that we could spare.